Let's discuss some of the treatment options that are available for men who are diagnosed with localized prostate cancer. Once a man is diagnosed with prostate cancer, if it's early, the good news is they have lots of treatment options. And so these options include what we call active surveillance or observation, certain local treatments with surgery, and there's different types of surgery, radiation therapy, different types of radiation therapy, and some newer things, cryotherapy, freezing, and HIFU, high-intensity focus ultrasound. We could spend hours actually talking about all these treatments and some of the excitement and how they work out, but just the 30,000-foot view of the overview of this is that active surveillance is underutilized, and that's why we have some of the controversy we have right now. There are certain patients that are candidates for active surveillance. Some of that has to do with being older, but even a younger person that has a very small amount of a low-grade cancer, we'll call that a Gleason 6 cancer with a low PSA that's not rapidly rising, would be a candidate for active surveillance. The issue is that with active surveillance is that we kind of determine this direction based on biopsies that are done transrectally, and just about every other cancer that we diagnose and treat, we do things like PET scans and lymph node biopsies and CT scans. Well, in prostate cancer, when you have a very low PSA and localized to the prostate, all these things are a waste of time. We want to know what's going on in the prostate. Did the biopsy miss some more aggressive cancer? And that's where some of the controversy is about active surveillance. There are some things that we can do, like rebiopsy and do more, make sure we didn't miss things. When we follow people, we follow them with PSAs and biopsies periodically. And the next one is surgery. And there's different ways to do surgery. You can do it under the scrotum. We call it perineally. You can do it open. You can do it laparoscopically. You can do it robotically. And there's a lot of hype right now about the robotic prostatectomy and so forth. At the end of the day, it's the person doing it. It's not the incision or whatever. And I hope people don't get really overwhelmed by the hype about some of these things. Radiation is different types of radiation. You can put seeds in the prostate, radioactive seeds. We call that brachytherapy. There's external radiation. There's different ways to do it. There's a lot of interest in protons right now and new proton centers. In general, that's probably not indicated for most patients. And then there's these newer things, cryotherapy, freezing. And we know that if you can put probes in the prostate, very small ones, and circulate argon gas through it, and these probes, and they freeze. And when you get down to -20, -40, you kill anything. So it's a good way to get rid of prostate cancer, and you monitor it with ultrasound. And then there's, we know that HIFU, high-intensity focused ultrasound, you can focus an ultrasound beam and right into the prostate and ablate it. It takes a while to go through it, but it works. Everybody's familiar with it when you were a kid, or maybe you do it now. Get in the magnifying glass and the sun and a piece of paper, and you focus it, and then you burn. Well, that's what you're doing with this. So a lot of new exciting treatments. They all have some downsides, but the good thing is patients have a lot of choices on how to treat their prostate cancer.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed. But right now, a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, The test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.